Yeah, so welcome everybody to the mini Community Pharmacy More Profit Roundtable. My name is Breck Rice. I'll be your host this afternoon and looking forward to spending the next few minutes explaining to you what I think is an amazing opportunity for our community pharmacies. I've been working with community pharmacies for 22 years now and love the industry. Will do everything I can to help. My full-time job is with a third-party claims processing company called ServeRx. I started back in 2003 with the grandfather of the industry. That company was Third Party Solutions, or TPS. Most pharmacies are familiar with that PCN in their pharmacy system, the bin number in PCN for TPS. But unfortunately, that company that I started with got acquired by a big monopoly healthcare organization and rolled that company up underneath their PBM, their big jumbo PBM. And I signed on to help community pharmacies, not to rob from them. So I decided to leave. Didn't want to be a part of that big pharmacy benefit manager. But that's okay because they gave me a going away present. About 3 days later, I get a knock on my door, and a sheriff's deputy delivered that going away present to me in the form of a TRO, or a temporary restraining order. So I don't know if you've ever had one of those before. They're tons of fun, right? It's basically a gag order, or a gag clause to keep me quiet so that I wouldn't tell the pharmacy industry what was about to happen. So the claims that were being processed by third-party solutions, those reimbursements were really nice. They were $60, $70, $80 reimbursements for workers' compensation claims. And when that big PBM got involved, they were only paying the pharmacies about $2 or $3 for the same claim that they used to get $50 or $60 for. And so they wanted to keep me quiet because I was the guy that sat down and did the business reviews with all the pharmacy groups, all the PSAOs, all of the grocery store chains that have pharmacies in them, and they wanted to keep their little dirty secret quiet so that they could just move all of those claims into their managed care and make millions and millions of dollars. So I fought that battle for 2 years and finally got out from underneath that TRO and started the new and improved third-party solutions company, which we call ServeRx. And I've been helping community pharmacies get those fair reimbursements they deserve for the past 10 plus years now. So in combined, 22 years working with community pharmacy and love them. Now, because of that experience of having to deal with the big PBM and that TRO, I have gotten more involved in legislative work, right, in trying to help do some PBM reform. And one of the things that I do besides the legislative work is I also host the PBM Reform podcast on the Pharmacy Podcast Network. Actually, just had a really interesting interview just about a half hour ago with Dr. Benjamin Jolly. I don't know, some of you in the industry might know the pharmacist, the Jolly Pharmacy family. They're kind of royalty in community pharmacy. The oldest community pharmacy in his city, and he's a third generation PharmD there. But recently he's gotten really involved with PBM reform and advocacy, and just spoke at a big rally that was one of the Sanders rallies. Had standing room only. I mean, there's thousands and thousands of people there, and he talked about PBM reform and what needed to happen there. And since that rally, about over 30 state attorney generals have come out to jump on board and talk about writing bills that would make it illegal for a PBM to own a pharmacy in their state. So pretty exciting changes that are happening now for community pharmacy. But I'm excited to share with you today, and I'll share my screen here with you. A opportunity that was brought to me not that long ago, just a couple of months ago. A friend of mine had some of you might know him, George Veronis, brought this to my attention that Seniors Home Services had a remote therapeutic monitoring program that they were thinking about opening it up to community pharmacies. And so I got pretty excited about that opportunity, because I'm a firm believer that community pharmacy needs to get more involved with clinical services. And I've been preaching that for the last couple of years on my full hour-long roundtable podcast that I do once a month. And been helping some of my pharmacy partners that have gone down those roads to try to get credentialed to do medical billing. And I know there's a cost to it to get set up to do medical billing. And so when George brought me the program with Seniors Home Services with zero startup costs, I saw a really quick way for our community pharmacies to use the pure profit coming in from remote therapeutic monitoring and the administrative fees that are paid to pharmacies, and how the pharmacy could use that pure profit to apply that to being able to get credentialed and pay for the setup to do expand their scope of services to do even more clinical services. So as I mentioned earlier, I host the PBM Reform podcast, and this is no secret to any of our pharmacy partners. They know that the PBM and insurance mafia are aligned against them to put them out of business. And so this is pretty exciting legislative work that's happening on the state level in order to make it illegal for someone like Caremark, big PBM, to own pharmacies like CVS in their state. So I know at least one state of Arkansas, has already passed that bill, and so what we're going to talk about today is 3 steps. The majority of the time we're going to spend on the remote therapeutic monitoring, step 1, because that's the lowest hanging fruit, the fastest way for a community pharmacy to start generating pure profit. We'll touch on step 2, which is getting credentialed for medical billing through the Independent Pharmacy Provider Network, and highlight just briefly step 3, which is expanding your scope of services to a full-blown brick and mortar clinic in your pharmacy if you have space for it. But to start with, the Seniors Home Services Remote Care today has an amazing program to help community pharmacies help their seniors. And the programs that they're bringing out are for all your 65 and older, even expanded beyond just the Medicare Part B patients, but also all the Advantage plans. Their programs will work for them as well. We'll talk a little bit about that administrative fee that you get as a pharmacy, and just the opportunities for your pharmacy to be involved with the remote therapeutic monitoring. I'm going to play a real short explainer video. Hopefully you can hear the volume okay.
It's no secret that pharmacies are under financial stress today and need to find new sources of revenue within their existing businesses. Seniors Home Services is happy to introduce you to our Remote Care Today program that can provide tremendous benefits to your customers and new revenue for your pharmacy. Our remote care service is clinically proven, done over tablet or smartphone, and a Medicare reimbursable program that can help prevent, treat, and often reverse chronic illness, musculoskeletal disorders, memory loss, cognitive regression, and loss of balance, thereby slowing decline while helping prevent falls and loss of independence. Our remote care services are backed by years of success in improving patients' quality of life, helping them remain independent for as long as possible. You can make these services available to your patients as we provide a turnkey solution, including patient engagement, enrollment, support, and Medicare billing under our Medicare NPI. Our patient engagement process is easy and fun with our complimentary Turn Your Selfie into a Healthy app and does not require any additional work for you or your staff. This biometric facial scanning app, which we personalize to your pharmacy, uses smartphone facial scans to read blood pressure, heart rate, oxygen levels, and risk factors with incredible accuracy, engaging patients in their own health by knowing their numbers anytime, anywhere. We also provide posters and bag stuffers with QR codes. As people use the app and receive results, they naturally engage with our support team and learn all about how our services can improve their quality of life. Information on your patient's monthly progress will be available in our secure portal. And if you choose to review their assessments each month, you can earn administrative services fees for the time you spend, all while helping your patients live better and longer.
So there are three buckets that seniors home services can help community pharmacies get involved in: the chronic care management, the remote physiological monitoring, or we call it the remote patient monitoring, and then RTM, which is the remote therapeutic. One of the advantages of working with seniors home services is that no one vendor can bill Medicare for all three services. And so what Seniors Home Services does with their Remote Care Today program is they work with multiple vendors so that you can offer these services to any senior patient. All three buckets can be done with those patients. We're going to again spend the majority of our time on the remote therapeutic monitoring because there is, that's probably the biggest opportunity right now, and it is what seniors are most concerned about. You ask anyone getting up in age, and as a pre-senior citizen myself, one thing I'm concerned about all the time is memory loss. I'm not to the concern yet of losing my balance or not being as stable as I once was, except when I'm putting up Christmas lights on my roof. Then I wonder, shouldn't I have my son doing this? But memory loss, that is a huge issue that seniors are dealing with. And if we can prolong, that cognitive decline, man, they're gonna love it. And that's exactly what these services are doing and performing. So want to share this with you. This is going into more details of exactly what the RTM program is all about.
Remote Therapeutic Monitoring, RTM, is a clinically proven and Medicare reimbursable program that not only helps recovery from accidents, but can be directed to help prevent and often reverse memory loss, cognitive regression, and loss of balance, thereby slowing decline and helping prevent falls, as well as helping with stress, anxiety, working memory, concentration, decision-making, and emotional control. In addition to the physical improvements patients can see, these programs can improve plasticity, which will improve patients' quality of life, helping them to remain independent for as long as possible. We are pleased to make RTM available to your patients and make it so easy as we provide a turnkey solution, including patient support and Medicare billing under our Medicare NPI. Introducing RTM to your patients is easy as we do the entire introduction and education for them. We'll send them a landing page, which can include a short video message from you, as well as educational videos, and then give them the opportunity to enroll right there. We'll also reach out by phone to assist with the enrollment process. When they enroll, our coaches personally call by phone to welcome them and send a welcome email with logins to their personal customized programs. Their personal coaches are available by phone as needed to help them along the way. As with all our programs, we take care of all patient support, coaching, encouragement, and all billing. Remote therapeutic monitoring can have a major positive impact on your patients without creating any additional work for you or your staff. Just click the Get Started button on this page to begin.
So one of the solutions that they're using is this Brain Savers. It has some really fun brain games and exercises. I'm not going to go take time to go through that demo, but just know that Jim Bland, the CEO of Seniors Home Services, just announced on an earlier call this morning that I was on that they're also expanding the way that the senior can get the exercises beyond just computer, tablet, or smartphone. They're actually now going to be casting it up on the TV as well. So that is a huge game changer for a lot of our seniors, because it's really hard for a senior to think about, okay, I've got to set my phone up somewhere and it's too small. I can't really see what the exercise that they're telling me to and showing me to do. But now they'll be able to cast it up on the big screen TV as well. Again, some of the things that the program is helping with is working memory, balance, coordination, fall prevention, etc. And so what the pharmacy gets out of this is a administrative fee by reviewing the progress. So it's simply going into the chart onto a cloud-based portal, reviewing the progress of each patient and getting compensated for that. So this is all there is to that.
Working with our program is easy for you and your staff. If you choose to review your patient's monthly progress and earn administrative services fees, you will be sent a weekly email notification reminding you to log into your portal and review patient assessments. You or an appropriate member of your staff will review these reports, review the summary data for the patient, add your notes, and then simply click the sign-off box next to the record. It's that easy, and it's that fast.
So it really is that easy and it's that fast. I was, just doing the math in my head saying, okay, if you had 100 patients on the RTM program and it took you even a full minute, which it won't, it'll take you maybe, closer to a half a minute, especially once you get really, really good at it. But let's say it took a full minute to review that and you had 100 patients on there, that's going to be less than 2 hours worth of work that you're getting reimbursed $25 per patient per month. So that works out to be over $1,200 an hour for your time. So not a bad return on your investment in time. Seniors Home Services is going to provide the marketing materials for you, the Selfie to Healthy program, which is a really wonderful program where the senior can actually just do a scan of their face and it gives them some biometrics, heart rate, blood pressure, some of those things that they want to check on a regular basis. But that's all going to be provided free of charge to our community pharmacies so that they can start this program along with all of the coaching and assistance to be successful at it. They'll even help you do the outreach to your patients, which is amazing. And you'll be under, a BAA or a business associate agreement, so that you have, HIPAA protected way of having them help to reach out to your seniors. But you can always, have the bag stuffers and that advertisement at your pharmacy as well. This is the demo on that Selfie to Healthy, or basically it's a facial scan. This is cool technology. It's kind of like James Bond, spy stuff here, where it's literally can get so much biometrics just from doing a scan of your face.
In today's healthcare environment, one of the biggest challenges for medical providers is engaging patients in proactive care. It's hard to convince someone they need help when they don't even recognize the signs. But what if there was a way to make the need clear without you having to be the one to do it? Meet a revolutionary solution for patient engagement: AI-powered facial recognition. We call it Turn Your Selfie into a Healthy. Imagine a technology that helps your patients track their health, identify risks, and stay engaged in programs like our health and wellness coaching to keep on track with their health, all without you having to perform the assessments or having lengthy discussions with the patients. This advanced technology provides an easy-to-use, self-guided experience for your patients. They can complete assessments from the comfort of their home, gathering valuable data on their own through a 30-second AI facial scan using their smartphone. With 96% accuracy and 98% repeatability, it can analyze metrics like heart rate, blood pressure, oxygen levels, health risks, and others. This is not a substitute for medical care, but it is an accurate way to identify symptoms that just might help your patient recognize the need for lifestyle changes and to make healthier choices with diet and exercise. In addition to the immediate on-screen results, a detailed report is also generated, which we will review with the patient and educate them on how our remote care services can be so helpful. It could also encourage them to become more engaged with our proactive cognitive improvement program, designed to improve both memory and balance. We provide marketing materials like posters and countertop materials. As people use the app and receive results, they eagerly engage with our support team and learn all about how our services can improve their quality of life. This isn't just about making your job easier. It's about empowering your patients and improving outcomes. So, what's next? Speak with your care consultant today to learn how you can enroll in the program and start offering our remote care services to your patients, all with no upfront costs. Together, let's make proactive health easier for both you and your patients.
So, just this is the pharmacy program review, just a real quick overview of everything that we've just covered.
Our process is simple. First, we'll create your co-branded, turn your selfie into a healthy app, and provide a customized poster and bag stuffers for your pharmacy. Your patients see our materials, scan the QR code, and are taken right to your selfie app without any downloading required. They fill out a simple opt-in form, followed by taking their own selfies. Within seconds after taking their selfies, the patient receives their scan results, along with information about our remote care programs, and are encouraged to contact us to learn more about their results, as well as about our paid-for by Medicare health and wellness programs that also improve balance, memory, and quality of life. To get started, your next steps are easy. First, complete our agreement and sign the BAA, which ensures HIPAA compliance, and then we'll schedule your onboarding meeting. During this meeting, we'll discuss how we engage patients and the materials we can print and provide you that help patients engage with us. We will then educate and onboard your patients using approved text messages, emails, and friendly phone calls, providing the patient the appropriate programs and coaching, all without any cost to you. Your pharmacy then has the option to provide monthly data reviews for each patient, which earns you monthly administrative service fees. Better patient health, new revenue for your pharmacy, improved patient loyalty. Let's get started.
And all that for free, which is my favorite price. So I love that that this program exists for for our community pharmacies. Now, phase 2 or step 2 is what I mentioned before, is the independent pharmacy provider network. This is actually getting credentialed, and I've had clients of mine spend thousands and thousands of dollars working with credentialing companies to try to get across the finish line and not get across the finish line. And I've had others spend thousands and thousands to get set up, but then not be able to collect on their bills. I've got one client in New Mexico that has over $100,000 worth of medical bills that he hasn't been able to collect on yet. And so I knew there was a problem with this, and there needed to be a better solution. And IPPN is that better solution. Not only is it less than half the cost to get set up and credentialed, but there are 4 key pillars to success. These same pillars for success are pillars for failure if done incorrectly. You need to have a turnkey software solution for patient engagement, scheduling, for taking notes. You've got to have a CPA, a collaborated provider that you're working with, and a CPA agreement that you're working under. You need a doctor to act as the chief medical officer for these services. And unlike the retail clinics that you've seen in the past, like the Minute Clinics or the Village Clinics, you're actually partnering with the local doctor instead of taking the patient away. So one of the reasons why those programs fell, and a lot of telehealth programs aren't that popular is because you're actually taking the patient away from their local primary care provider. This is working with the local providers, and IPPN will help you recruit those providers as well. And then the billing and collections is key, right? Like my one client who is in network but can't collect on the bills. Well, it's because he was not building the correct modifier codes and didn't know the proper way to bill for on the medical side. So these are all things that IPPN has a turnkey solution for, for our community pharmacies. These are just some examples of some CPT codes for preventative health and office visits, and then even diagnostic services at a future point down the road. The last step 3, just going to touch on this. This is if your pharmacy has space for it, you can build out a complete clinic. It takes about a 10 by 12 footprint, but you can have a full clinical room. Pharmacy owns it. It's your clinic. That's even your name, your pharmacy's name, powered by Brim Wellness. So Brim will actually operate it for you, manage it for you, and they'll even staff it for you if you need it. That number 2 there is the talent exchange. Imagine it kind of like Uber for nurses and medical assistants. So you only have a nurse there in the clinic when you have patients to be seen. So why pay for a FTE if you don't have any clinics that day? So that's a wonderful program and approach to the clinical services. And then the third leg of the stool, I'm super excited about. It's a financial vehicle, not only helping community pharmacies actually pay for the build out of putting up the 3 walls or 4 walls that are needed and bringing in the hand washing station and getting all the equipment, the exam table and all of that. But this is also another vehicle for the pharmacy to generate more profit. Not only can you borrow from it, you can be a cooperative member of the pharmacy fund that will help additional community pharmacies get their clinics set up, and you'll be making a interest rate that's 10 times what any bank is paying you on the interest right now. So I wanted to share that with you. So just recapping, the opportunity for community pharmacies is with remote therapeutic monitoring with seniors home services, that administrative fee, 0 startup cost, but you will earn $25 per patient per month. This is a residual for you. And I invite you to get with your care consultant today that invited you onto this mini roundtable and get enrolled, because again, there is no cost to you, but nothing but upside. Yeah, well, thank you everybody for being here today. And we do host this every Wednesday afternoon for our pharmacy partners. Please tell all of your peers and invite them to join us. And we would love to help them make more profit. And like I said at the beginning, I've never, it's been a lot of years since I've been this excited for community pharmacy with these opportunities that are available to them now. So thanks so much for your attendance, and we will see you next week. Thanks, everybody. Take care.